Are we live? Are we good to
Live.
go?
I think so.
Yay. Well, hi, everyone. Hi, Jason. Hi, Frank. Hi, Dominic, and others that we can't see. Hi, everyone, for joining us today. Thank you so very much for tuning in. Um, we had taken a little bit of hiatus, but we're planning on continuing these town hall meetings every other week going forward, especially as we are getting closer to schools, public schools, and the colleges reopening. And we continue to get questions coming into us. Um, we, especially around how can that happen and how it can happen safely. As we work through this pandemic, there are always going to be questions as different parts of our economy and our community, are opening up or different things are happening. So we want to make sure that we are in tune with you and sharing as much information as we can share. Um, Please continue to submit questions. Some of you have submitted questions already, but the chat function, I think, is available for folks to submit questions as we go along on YouTube. And I want to pivot just a little bit and say that this week the legislature published a letter in our local media, our local print media, to the community on expectations for institutions to continue to be transparent. Cornell is opening. Ithaca College is also have some semblance of reopening. TC3, and it's important to all of us as a community that their plans, that whatever it is they plan to do, how it's going to roll out, that they are transparent with those plans and that we are all working together. So we issued a letter calling on all of our institutions or institutions of higher learning, especially, to be transparent. Uh, and we also asked our students, the students who are returning to our community, to take responsibility to help us stop the spread. Tompkins County has done incredibly well throughout this response to COVID-19 and the spread. We've kept our numbers as low as we can and keep them, and try to keep people safe. So we don't want there to be uh, a moving away, a deviation from that trend that we had set in keeping our numbers low and keeping this under control. So for our students who are returning, for our families who are coming back to the community, because our students are part of our community's family as well, our community family as well, we encourage you to please, we urge, not just encourage, but urge you to please be responsible as we have been in this community, those of us who live here year round, uh, to take all the necessary steps to please follow the guidance of wearing a mask. No, it's not fancy, but it protects us. It protects me from you and you from me. I always have my mask very handy. So please wear a mask. Please continue to social distancing, 6 feet apart. Minimize gatherings because it's very easy for this disease to spread when we are gathered together. Even as family members, it can happen because as family, we're not all in the same house all the time. People go different places and you never know what can happen. Wash your hands, avoid touching your face and mouth, and avoid as much as you can crowded spaces. Let's try not to have crowded spaces to begin with. We know it's been hard. People have been cooped up and want to get out. We want to enjoy the fresh air in the outdoors. And yes, we want you to do that, but we want you to do it safely. And one of the safest ways to be able to do that is to wear your mask. So we appreciate in anticipation the fact that you will follow those guidelines and help us to continue to keep our community safe. Um, so our community has been working a lot on these things, and we encourage you to do so. I also want to take a very quick moment just to share that and I'm sure Jason Frank will speak more to it, that as a community, we are working with our neighbors. We're working with law enforcement. We're working with our neighbors because we want to, just enforce the rules, enforce those guidelines. We want to continue to urge people to do them and do them the way we're asking you to. So in the event that, someone makes a complaint, calls I think it's 273-8000 is the number, non-emergency number to complain. We're making that available because there's a large gathering of people or whatever it is. Our sheriff department will respond. And I want to emphasize that I know there's been a lot of concern in the community around law enforcement and law enforcement response. The sheriffs will be on duty. They will be in uniform. Yes, they will have their guns. I'm being straight up with you, because if they're on duty, they will be armed. But it doesn't mean they're coming there, guns drawn. That's not what it's about at all. We have put in place a process for more educating people when our sheriff's department shows up. They will show up throughout this county, including the city of Ithaca. And so we don't want people to be surprised when you see the sheriff show up in the city. They're not coming there to, immediately arrest anybody or anything like that. They're coming really to just encourage and talk to folks about following the guidelines, about using education first. Our nation, our community, especially those of us who are Black and brown people, have concerns about law enforcement showing up. That is a reality, because any number of things can go wrong when that happens. In this case, we're not trying to have that happen. We are asking that our deputies who show up with an attitude of community engagement, an attitude of community education. So I want to make sure I put that out there from the jump, and you'll probably hear more about it, that's what we are doing. Not coming to arrest and accost folks by any means, but urge that you do the right thing and spread education around safety for all of us in this community. So thank you all for letting me rant for a minute. We continue to work with all our community partners, and we thank them for all the work that they're doing to spread the message as well, and want them to continue. Please listen, please pay attention, please help us all to stay safe and, stop the spread of this disease. We can do this working together. That said, as I mentioned earlier, we got a number of questions that came in from the community. And before I jump into questions, I'm going to take time to just make sure that people who are on this call say who they are. So in case there's any new people who showed up today, they'll know who is who. Jason?
Sure. Jason Molino, I'm the county administrator. It's good to see you and good to see everyone today.
And I'm Frank Krupa. I'm the county public health director and mental health commissioner.
All right, those are the ones who you can see, and who you can't see behind is Dominic Recchio, who is our communications director for Tompkins County, and does amazing work. All right, so that we don't keep people waiting too long, I'm going to jump right in on the questions. And my first question that came in, actually, it's for either Frank or Jason or both of you, whoever wants to answer. And the question is, what are the tenets of a good reopening plan for a county K through 12 district in general? And the second part of the question is, what are the most important priorities to consider?
So I'll jump in first, Leslyn. For any plan, one of the most important tenets is communication of that plan to those that it's going to impact. And so I think our school districts are undertaking that endeavor now to try to reach out and have community opportunities to hear what their plan is and provide feedback to it. So I'm glad to see that that's happening, and I encourage folks to participate with their local districts in those opportunities. As far as the more public health related tenets, they're really the same as what we've been telling folks all along about how we prevent the spread. Mask wearing, right? That needs to be a significant component of the plan. There needs to be processes on, one, making sure that it happens, two, creating opportunities for breaks for folks that are having to wear masks for long periods of time, and just really educating the folks that are coming to the schools about how to do it successfully. Hand hygiene, right, is a really important thing, particularly in K through 12 schools. So we want to build in opportunities to do that. Teach the kids how to do it right for 20 seconds, give them a song to sing or whatever it might be. Understanding that, if you've got 10 kids and you're taking 20 to 30 seconds to wash hands, that time adds up in the course of the day. And we know that, but we still got to build in that time to make sure we're able to do it. And then really distancing, right? Making sure that, we're able to maintain at least 6 foot of separation between the kids and the staff and the teachers as they're going throughout their day whenever possible. And that really leads to decreasing density, because we're not used to setting up classrooms in that manner. So the distancing will hopefully address density as well. And then a new bit for folks is cohorting, right? Kind of a new word that you hear out there. It's fairly common for us in public health, but it's about putting groups of people together and limiting their exposures to others, right? So hopefully you'll be seeing in your district plans where your children will be in the same group most, if not all of the day with the same children. The number of adults that will be coming into and out of those cohorts should be limited to limit additional exposures. And that will really make a difference. One, for helping us prevent the spread, but two, if we do have a case, the fewer folks that are exposed is the less impact it has on the larger school as a whole.
Thank you, Frank. Anything from you, Jason, to that, or Frank got it all?
I think he captured it all.
All right, thank you. Other question? Do you have any advice for K through 12 for students or parents who might still be nervous about reopening? And then there's a second half to that question. What about for college students and their parents?
I'll take this one. So, we have 3 school-age children in three different grades, 2 different schools up in the Trumansburg School District. And I think the answer to that is parents are nervous, and it's okay to be nervous. We go through the discussion every day, as probably most families do, of sending our kids to school, doing it remote, and going back and forth, and that's okay. I think every decision by a family is got to be right for their family members and for their circumstances, and there isn't a right or wrong, and that will be different for every family based on their circumstances. So as long as people can appreciate that of each other, and that what works for one family may not exactly work for another, and vice versa, that's okay. I will say that we've been working very, very closely with all the school districts. Frank and his team have been, and the school districts are trying to really take every effort to ensure that there's every opportunity for both the parents and the students to feel comfortable and still allow them to be educated and still enjoy the benefits of school. So I think the one thing I can say is acknowledge that yes, I understand you're nervous. We're all nervous as parents. And that's okay. And as you go through the process, understand that the decision you make is what works for you and your family, and that's okay. And that may not be the same as other families. It may not be the same as your neighbor. It may not be the same as your friends, and that's okay as well. It's really about what best works for you. And so that's really my advice that I would give to parents as they go through it. It's perfectly normal. I know we have in my family, we go back and forth every other day about what we're going to do. And we've got, I've got young children from the ages of, 1st grade, 2nd grade to 5th grade. So, difficult decisions. And I think the unknowing, not knowing, and the unknown is what makes people nervous, but try to make the best decision that works for you. As far as college students and parents, same thing, but also I think there's a higher level of expectation of personal responsibility. College students are young adults, and young adults, I think we have an expectation that you understand the rules, you understand the compliance, you understand how the disease can be spread, and to complement what Leslie, you talked about earlier, what Frank just talked about, density, face coverings, distance, making smart choices. I think when we talk about college students that are young adults and their parents, we expect them to make good decisions because they can and they're responsible folks. So I think that's all the advice I can give for K through 12 and college students. But
Frank, do you have anything to add?
I'd really just add that the districts are working really hard to take care and provide the safest environment possible. But as Jason said, it's okay to be nervous. It's okay to go back and forth. And ultimately, every family is unique and their needs are unique. And it's okay to make the decision that's right for you and your family, while our districts are working hard to provide the safest environment they can.
So if I may ask a quick follow-up to that. So as a parent myself, one of the questions that I had was, just thinking, should I get my children regularly tested if they return to school? Should I be concerned? Let's say they come home and say, I have a little tickle in my throat. Should I be testing them, regularly just to make sure? Or do I just wait until all kinds of symptoms show up? We also know that people are asymptomatic often. What should I do? Is there any advice on that?
Sure, we've been getting that question a lot, Leslyn, and so I know families are wondering about this. The important thing to know about the testing right now is all it tells you is in that moment in time that the sample was collected is were you positive or not, right? So it's a moment in time snapshot. If the next day you could go get tested again and be positive if you were negative the day before. So really, the people we would encourage getting tested are those that have symptoms, right? And what's a severe or not a severe? It's really about symptoms. And if you have them, go get tested. And if you have questions, talk to your healthcare provider. That's why they're there. They can help you navigate through those things. We're not recommending what's generally called surveillance testing for K through 12, which would be regular testing, similar to what we've heard from some of the higher ed folks. Mainly because, again, it is that snapshot in time. And unless you're doing it every couple of days, it really isn't providing an extra protective factor. So we would encourage folks that are symptomatic or have concern to get tested and or talk with their healthcare provider, but don't expect that there will necessarily be surveillance type testing for K through 12.
All right. Thank you for that. Frank, this question is for you also. Has there been any new guidance released from the governor in the past month as far as it relates to COVID-19 and preparing schools to reopen? Anything around testing protocols, public meetings, anything with parents?
Yeah, probably the biggest thing is he gave the go-ahead for schools to reopen in person. So that was a big one. But more particular, we mentioned there is a requirement for districts to have at least 3 public meetings with families and 1 with their staff. So I know those are already ongoing. They are required to have processes in place to deal with someone that needs to get tested, i.e. a symptomatic child or staff or faculty. Most of that planning will be to send them to the drive-through that we have here in town and or to seek advice from their healthcare provider. We're not going to be setting up testing clinics in schools or that kind of thing. It really is about using the community resources that we have in place. And then they have to have a contact tracing plan in place. And as I think everyone's aware by now, the health department has primary responsibility for doing that. And really those plans are to support and work with our public health nurses at the health department in doing that contact tracing. So, if there is a student or a faculty or staff that does test positive, we're going to need support from the district to understand potential exposures. And we have good relationships with them, and I'm confident their plans will align with ours, and we'll be able to do that successfully.
Thank you.
Sure. And one other thing, Leslyn, that's probably important to point out as well is that the districts are required to have a virtual only option. So for those families that choose to not send their child back to school, their child will still get the education that they're entitled to. And that's important for folks to know.
Well, thank you. maybe at some point we can hear a little bit more from the superintendent of schools and others about, managing the equity issue for virtual only students, because we know that has been a little bit of a concern. All right. Sorry, Frank. I'm coming at you.
No worries.
What are the best things that local residents can do to ensure we don't get another spike? And yes, we've heard about the mask wearing and so on, when colleges and districts resume in just a week or two. What are the best things we can be doing?
Yeah, I'm a broken record on this, Leslyn. I know it really is about those basic things: mask wearing, distancing, keeping density down, good hygiene. I think one of the most important things, and we've talked about this on previous town halls too, is personal responsibility, right? In almost every instance, you have the choice to keep 6 foot of separation between you and somebody that perhaps isn't wearing a mask. Or you might see a group of people that you think should be wearing a mask. Fight the urge to go up and say something to them, right? Because by getting closer, you're exposing yourself. Obviously, we're doing everything we can to get the word out, but it really is about personal responsibility and doing as much as you can to not be in those types of situations. But it really does boil down to the mask wearing, the social distancing, and the hygiene. And I know folks probably want to hear something different from me as this continues to progress, but those are core, they're the pillars that we've been using throughout this, and it's gone well for us here because people have followed that guidance. And the lights are turning off on me. I apologize, but yeah, it's those same things, and we would encourage folks to keep trying to be vigilant in achieving those goals.
All right, and we've also heard in the news about changes to the ventilation systems and so on for malls to open in other places, and I'm assuming the same for school. The question came in from a parent who said, my daughter's preschool has not received any guidance on ventilation as a part of COVID transmission prevention measures. Can you address this?
Sure. So generally, well-functioning, well-maintained air handling should be sufficient. So, if your building has the appropriate ventilation built into it, that it's maintained, filters are changed regularly, that should be sufficient. We've obviously heard about the requirement for malls. Those are large buildings that tend to have minimal air transfer from inside to outside in order to maintain temperature, both hot and cold. They're large facilities that have the potential to have large people in them. So they are different in why there's more significant concern there. But if any facility feels like they haven't gotten appropriate guidance, they can always reach out to our health department. Certainly head to our website. There's a lot of good information there, as well as links to state and federal resources. But we're always willing to try to answer questions for anyone in our community that might have them.
All right. Thank you. Frank, I have one more for you, and this time it's away from schools.
Okay.
And to business. From your perspective, Frank, is there a safe way to reopen gyms and fitness centers in the county? What guidance have you received from the state and others in regards to gyms reopening?
The state guidance is pretty clear, and it has remained consistent that gyms are not allowed to be open. And I know there's a lot of folks that are concerned about, and as the public health director and mental health commissioner, regular exercise is core to what we want folks to be doing. And so I get it. I get why folks want to get back into the gym. But because you're exercising, you're exhaling more frequently, you're exhaling harder, and potentially spreading the virus more broadly in the space that you're in. And so that's generally why gyms are still not open. Plus, much of what we've seen around the country is other states have opened their gyms and have had to close them because they've had outbreaks associated with them. It is a state decision ultimately on when they will be open. What I would offer is, we would support gyms being creative. And if there are ways to move activities outdoors, and keep people, with a proper social distance and still have those activities that they might want to do, we're okay with that, and we would support them doing that. We want people to get exercise. We want them to be active, and particularly while the weather is still good, moving as much as you can outdoors is a good, hopefully creative solution. And we would encourage gyms to be creative within the guidance, right? Understanding what is the underlying intent of the guidance, that is to not have physical activity happening indoors with people close together or in large groups, and see if there are alternative ways to offer services or opportunities for their members.
Thanks for that, Frank. And as a quick follow-up, if someone sent a question that says, not all gyms and fitness centers are the same. I think you answered some of this. Some of them have classes and more open studios where people are not, on top of each other, while others have lots of equipment. How might safety guidelines, and we understand that they're still, closed. So if folks choose to take outside and you bring all the dumbbells outside, what are some safety guidelines that they potentially could use, or how might they vary depending on the characteristics of a particular center or gym?
Sure. So just to be clear, indoor gyms are closed by order of the state. But if there are ways to move outdoors, particularly keeping distance between the participants, certainly limiting the sharing of equipment, but if you must, make sure that it's clean between each use, so you're not potentially touching similar surfaces. And I know our gym owners are creative people, and they care about their membership. And, I would just offer that we are open to them finding creative solutions, as long as they, align with the guidance and meet the underlying intent of that guidance.
Thank you. Frank, I'll give you a break and I'll jump to Jason, because for many businesses, gyms and fitness centers included, this has been a very difficult time. That is the core of their work and the core of their finances. Jason, what do you think can or should be done to help these gyms and fitness centers through this difficult time until they can reopen?
Good question. Unfortunately, some business sectors have been impacted differently through several of the areas of the shutdown in our economy. I will say that this is a question that comes up weekly on the control room. So we continue to ask the questions. It's something that I've spoken to gym owners about and some fitness centers about specifically, because some of them have been very creative and productive in terms of being able to try to create a safe space in the facility. Unfortunately, as Frank's already touched on, it's just not anything that the state right now is in the place to be able to open. So, I'll just second what Frank has said. We'll in order to get folks open to be able to continue to provide service to their patrons, outdoor is an opportunity, and I know we'll work with them to the extent that we can within the guidelines to ensure that they can possibly open some level of business again outside. From that perspective, I will say that there have been a lot of creative business owners that have worked to really work within the boundaries and the guidelines to at least have some level of business, maybe not the same way it was before. But the only thing I can offer is our environmental health team down in the public health department has been remarkable in being able to be responsive to people in order to help them work through challenges. And if there's a particular business owner, whether it's a gym or fitness center or not, that has an approach that they want to take to try to fit within the guidelines, I would encourage them to contact us down for that environmental health department and talk to us about it. And I know we've shown a lot of commitment to working with folks to trying to help them and at least give them some guidance as to we think this can work or this can't work. So I know that's a lot more hands-on than I think most folks are being able to provide, and most communities are being able to provide, but it's a great service. And our environmental folks, health folks are committed to working with our businesses to try to give them the best opportunities they can within the guidelines. I think that's the most that I think we can offer right now to folks. And there's been a lot of success stories where we've been able to do that with them.
All right, thank you. Um, Jason, for you again, this question
Sure.
came in. It said, I saw your press release last week about gatherings, and it goes in with my rant from earlier on.
Right.
What types of gatherings should people report, and exactly what happens when the sheriff's office shows up at a gathering?
Sure. So, you really made some strong points earlier, Leslyn, about our ability to respond to large gathering complaints or concerns that people may call in through the non-emergent line. Several things to think about. Obviously, if there's large gatherings of individuals where face coverings and physical distancing isn't maintained, and there's large densities of individuals where those two elements aren't being maintained, that's something that should be reported. At the same point in time, we always have to be conscious of it. Could be people that are living together, it could be families. So we have to be understanding of those things. As far as the sheriff's office responding, so our folks, our deputy sheriffs are responding throughout the county as they normally would. They are providing assistance inside the city, particularly in the areas where you will see larger gatherings or parties, many times related to higher education, but not always. Meaning students. So your city is your more densely populated area, the city and the town, and that's where we think there may be more of those gatherings taking place. And when they respond, you hit it head on. They're coming from a community engagement perspective. They're coming from an education perspective. One thing that's very similar to the sheriff's environmental health and our entire approach that has been very successful and has shown a lot of success, and which is, I would say, a direct result of the fact that we have one of the lowest infection rates of counties in New York State. And knock on wood, we have not had an in-resident death as a result of it. Not too many counties can attest to that. It's because we are taking a very proactive education approach. And our deputies are going to educate people. They're going to talk to people. They're going to try to encourage them to comply. And that's the approach that we are going to take. And they're not, and that's how they're going to approach this. They're not, as you said, there's not going to be any forcefulness or any of those lines. It's really about education. I'll elaborate a little bit more, Leslie, because the question has come up of, well, why are we using uniformed officers or the sheriff's office to be able to respond? So this is a direct response to the fact that, well, number one, our environmental health unit is worked to the max in terms of its capacity with what they're doing with supporting businesses and following up with businesses. Also, our environmental health unit is not a real-time responder, meaning they do not respond to immediate calls. So the real-time responder is our sheriff's office, our deputy sheriffs, and they do a wonderful job for the community. So our primary reason in working with our folks in the sheriff's office is that they have the ability to respond. They have the skill set to talk to folks. They have the skill set to educate folks, work with individuals, and they have a good community engagement relationship. So that's the primary reason we are working with our sheriff's office. And to an extent, you'll see similar engagement when it comes from Cornell police officers or IC police officers. I mean, in terms of the college or other jurisdictions, our law enforcement folks have the ability to engage. They have the ability to talk, educate, build rapport with individuals, and that's really the approach that we're taking with this. So, what should you do? What you should do with anyone. Talk with them, understand what's going on, share your concerns, and have good dialogue. And that's what I would encourage folks. So, I hope that answers the question of the individual that asked it.
I think it did, and thank you for elaborating some more on what people can expect. Frank, I'm going to come back to you. This question is for you. The Cayuga Health Sampling Site has moved to appointment only and now costs $99, which, for some folks is alarming for those who don't fit the criteria. Who do you recommend get tested?
Yeah, that's a great question. And I want to start again, every time we talk about testing, and thanking Cayuga Health Systems for what they've been able to do for us as a community. If it wasn't for their efforts to stand up testing early and in a big way, I don't think we would have been as successful as containing the disease as we have been. So a large thank you to them. As far as who do we recommend get tested, first and foremost is those people that are sick, right, that have symptoms. We absolutely want them to remember please go get tested. Even if it's minor symptoms, go get tested. It's better for us to know than to not know. And there is no charge for that. That is considered medically necessary. If they have insurance, their insurance will pay. If they don't have insurance, there are other mechanisms for the health systems to seek reimbursement. The individual will not be charged. So those are the first group of folks. Also, anyone that was a close contact of a known case, right? So generally when the health department does our contact investigations, we will talk to the individuals. We don't always recommend, if you're a contact and you're feeling good, to immediately go get tested. Stay in quarantine for a couple of days, let the disease incubate if it's going to with you, and then go get tested. So you know. Remember, we said testing only tells you in that moment that you were sampled whether you're positive or not. And if you were just exposed today, you're not going to test positive tomorrow. It will likely take a couple of days if you are going to contract it. So those folks should definitely go and get tested. Beyond that, we start moving out of medically necessary and into the area where reimbursement is not clear for that. Cuyahoga Health Systems has criteria in place currently that includes essential workers, other workers that have come in place from other phases, all the way up to protesters, fitting within their criteria for testing with no charge. So that still exists today. That may change if we can't find other solutions, but for right now, those folks can still get tested without charge. The ones that are being asked to pay are individuals that don't fit into those criteria that we've had established throughout the pandemic. Someone that may have traveled to a state that has high incidence and is returning and just wants to know, right? They don't currently fit criteria. And up until recently, they were being turned away because there was not a mechanism to pay if you could. And so Cuyahoga Health Systems has put that in place so that those folks could get tested. We've also seen students returning to colleges outside of Tompkins County that are being told you need to be tested before you come back. And so though they were being turned away, now there's an option that if they can pay, they can pay. So it really is an evolution of testing. I will say that the state has set up testing sites. The closest one is in Binghamton. I believe there's also one in Syracuse where any New Yorker can get tested for no charge. So yes, there is a drive involved and transportation necessitated, but any New Yorker can get tested a short drive away. But that's where we are today with our local testing.
So there's a quick follow-up, Frank, to what you said about medically necessary. Do you need a doctor's note or something or okay to be considered medically necessary?
No. If you're symptomatic or you're a close contact, you will be asked those questions as part of the screening process at the testing site. And if you meet those criteria, that is all that's necessary. A doctor's note is not required.
All right, thank you. And I do want to reiterate what you said, a great big thank you to Cuyahoga Health Systems as a partner in all of this. They certainly stepped up right away and helped us in keeping this disease spread under control with the amount of testing and so on and so forth. So thank you for acknowledging them. Someone is asking of you, Frank, how do I assess my risk of spreading COVID-19? I want to get together with friends, and there are very few cases in the community. So how do I assess my own risk of spreading it?
Sure. So there's two ways to spread the disease, right? It's you getting it and becoming another case, or you having it and giving it to someone else that didn't have it. In both of those instances, similar things apply. Assessing where you've been. Have you been vigilant in wearing a mask? Have the people around you been vigilant in wearing a mask? Have you been maintaining social distancing, keeping 6 foot of separation? Have you stayed out of large groups? How good have you been in following the guidance that we've asked of folks? And that really has to play into your assessment. And then if you're going to visit friends, what is that environment going to be like? Is everybody there going to be wearing a mask? Are you going to be committed to staying 6 feet apart, not necessarily giving giant hugs when everyone arrives, right? What is that environment going to look like? And you really have to assess that for yourself. And then, always, we should say this more often, vulnerable populations, both from the person worried about it, but also the people you're going to visit. If there are individuals that are in those vulnerable populations, those over 60 years of age or with underlying health conditions, you need to assess that as well, right? Because that adds risk factors too. So all of those things should be part of your consideration when you're making decisions about your activities.
Thank you. And like I said earlier, we know people have been isolated, and if you really don't have to, we do our best to have dinner by Zoom, gathered by Zoom. I hope she wouldn't mind me sharing, but our legislature colleague, Martha Robertson. Martha, I hope you don't mind me sharing. You can, yell at me later, talked about having their, family Passover celebration by Zoom with people from all over the country, and interesting, but still people were able to connect. So we're not able to get together. If anybody knows my family, we love a good party, but I am not hosting any dinner parties, so don't come over. I'm trying to do my part in stopping the spread of this disease in our community. Another question for you, Frank. When is it safe or okay to not wear a mask?
So that's a challenging question in the words that are in it, but the answer is fairly simple. If you can't maintain 6 foot of separation and you're going to be around someone for more than 10 minutes, you should have a mask on. It really is that simple. The safe, when is it safe not to? I mean, we also say if you're living in the same home, you're not wearing a mask around your partner or your children necessarily, because you're just together. That doesn't mean it's safe for you. It just means you're exposing each other. So, the wearing a mask when you go out doesn't do any good because you're already exposing each other at home. So that word safe kind of makes it challenging, but it really does boil down to, if you can't maintain 6 foot of separation, you should really be wearing a face covering.
And as a quick follow-up, for folks who work in an office together, like I'm in my office, is it safe for me to not be wearing a mask because no one is coming in here? Mm-hmm. But if I get out and I'm going to go to the copier, that's a shared equipment, I should put on my mask.
Yep. Yeah, absolutely. And it's really, you have to be able to guarantee that somebody's not going to be within 6 feet of you. So you're in your office, Leslyn, and you need to go use the photocopier. You should, at a minimum, take your mask with you, probably put it on, because you can't guarantee you're not going to bump into someone in the hallway or at the copier. And so it really is about protecting the other person. And so it's a kind thing to do. Just be prepared to have a mask with you. So if you get in a situation where you cannot maintain 6 foot of separation, you have it to put on.
Thank you. Colonel is suggesting there might be over 1,000 new cases when students all return to campus. Is that over an entire semester or just when people return? And the second part of it is, does that impact our infection rate for schools reopening? And either you, Jason, or Frank, either one of you.
Sure. So the 1,000 to 1,200 that was in the modeling was over the semester. So it wasn't expected at the reentry point. So it is something that if it does occur, we're expecting would happen over the next few months. As far as it impacting our infection rates, yes, it will. If we have more positive cases, we have more positive cases, and we would report such, and that would be included. What I would point out that the reopening plans or opportunities that the state has laid out are designed around regional numbers. So in our southern tier region, the control room that Jason referenced earlier, there's about 650,000 people, roughly in that region. And so it would take significant numbers of cases to hit those thresholds. And so I don't think, while there will be work and things that we need to do related to an influx of several hundred cases, I don't think it necessarily in and of itself jeopardizes our ability to continue to move forward through reopening and reactivation.
I would only
Okay.
add that the infection rates are measured. The metrics are usually over averages over several days. So these cases aren't going to happen at once. If they do, they'll be spread out over time, which allows us to respond with different, better resources over time. And that when they start looking at if impacts of possibly affecting reopening, it's going to be over rolling averages over several days or a week at a time.
Okay. Thank you. Another question here for you, Frank. It says, I'm a teacher and I understand that I might not be notified if there is a positive case in my classroom. Can you let me know what specific scenarios I would be notified of if there's a positive case? Even if the classroom is ideal and distance, there are still corridors and shared transit spaces.
Sure. So this goes kind of back to our contact investigation and tracing. If a student was in the classroom, particularly for a whole day or even half a day during their contagious period, we would be looking to the school and the teacher to help us understand what their activities in that classroom might have looked like to understand exposures. So in most cases, a teacher is likely to know if there was a positive case because we're going to need some information in order to do the investigation. They may not know what particular student, right? Because we're going to protect that student's privacy, but they are likely to know. That's not 100%. There's always a scenario out there where maybe the student was only there for 2 minutes and somebody recognized they had a symptom and they were removed from the classroom immediately, and that wasn't the teacher that did that. So there's always a scenario out there where that might occur. But if there was a potential exposure to the teacher, meaning that the student was around them for an extended period of time, either wearing a mask or not wearing a mask, or whatever the scenario might be in the classroom, the teacher's likely to know that. And I know the districts are working on in their plans what they will do if they have a case within a classroom. So I think it is likely that a teacher will know. As far as the hallways and that incidental contact, we don't consider those close contacts. And there could be a student in a classroom that walked through a hallway. Everyone that was in that hallway, if it was just a passing by, may not know, right, in those instances, because there's no exposure really, and the risk is very minimal. Those are kind of two different scenarios. One where I do think the teacher will likely be aware if there was a student in their classroom, if they were in the classroom when they were contagious. If it's just passing in the hallway with a student that's not theirs, they are less likely to know the particulars about that.
Okay, thanks. Another one for you, Frank. When there were positive cases at Wegmans and Green Star, the Tompkins County Health Department posted a positive case on their website and allowed those individuals to be tested. Will the same be said for any positive cases at Cornell, as in the building and time of day will be identified so that people who may have been in contact with those individuals can get tested?
So that's a good question, Leslyn, and I think there's some nuance there to talk about. So when we had a grocery store with an exposure, we were in a different time, and we were not taking the same level of precautions that we're taking now around mask wearing and distancing. Some of those were in place, but not all of them. We were still learning how to do it correctly. And so it was a different time in the pandemic. Now, particularly with higher ed taking pretty dramatic steps to put mitigating factors in place, just being in the same building with someone doesn't necessarily create a point of exposure. And that's really where those notifications come from, is when we think there was an exposure to an individual that we can't individually identify, right? So for example, there's a student in a classroom in a building that has 5 classrooms. We'll look at that classroom and see what kind of precautions were in place for the individuals that were in the classroom and make determinations there if there were close contacts. As long as there was no other contact with any other room in the building, we likely would not be reaching out or making an announcement about that, because there isn't an exposure route. What I do believe I understand from Cornell, I know the students are going to be tested a couple of times a week. I know faculty and staff will be tested as well. So I imagine, particularly on Cornell's campus, if that's what we're specifically talking about, there will be ample opportunity for anyone to be tested, particularly in situations where there might have been exposure.
Okay. And I have another question for you, Frank. How is the impact of community spread of COVID-19 due to false negative diagnostic test results and asymptomatic positive individuals being addressed and mitigated by the county and our partners?
Sure. So no test is perfect. The test that is being used right now is very good, and there's limited potential for false negatives or false positives for that matter. I think, again, I think the question you asked about community partners, whenever you develop surveillance testing, similar to what Cornell is proposing, there's so many opportunities to be tested that the more you're tested, even if you had a false negative, you're likely to have that caught shortly thereafter at the next test. The chance of getting 2 back-to-back tests with a false negative is almost infinitesimal. And so that also helps ameliorate those problems with it. But I would tell folks that we've been using the same testing throughout this pandemic, and we've caught cases of asymptomatic individuals and have been able to isolate and do appropriate quarantining. And we have not seen spikes of cases from someone that tested negative and then somehow created an exposure for other people. So, so far our experience has said our testing is effective enough for us to control the disease. And certainly Cornell, with their surveillance programming, is adding additional layers, at least for their populations, to ward against that.
So it seems like all around we're trying to take as much precaution as possible and put as much checks and balances, so we can validate or not validate the testing, whether it's negative or positive, and anyway, any of those arenas. Certainly, I want to thank you for answering those questions, Frank and Jason. Jason, is there anything you want to add to this conversation to sort of wrap things up? I don't see any more questions unless Dominic lets me know.
The only thing I would add is just to reference one of the questions earlier about parents feeling nervous about what to do. It's a perfectly normal feeling. I mean, in terms of the circumstances that we're facing, we have an unknown certainty about it. Parents are probably going through different perspectives every day as to what to do with their child. I know we are as a family, and that's perfectly okay. Make the decision that works best for you. And I would also add that, this is still, the circumstances that we're all facing are high anxiety situations, right? And we've encouraged amongst our workforce, and we encourage again in the community, we have mental health services available for folks to talk through these issues if you're feeling a sense of high anxiety. And I say that from a community perspective. We have a good mental health clinic, we have good mental health services. So if folks feel a need to talk about the issue or feel a need to reach out, we want to continue to encourage and push those services because they're available to folks, and we're ready and available to work with individuals based on their needs. And I think that's the only thing I wanted to put out there. And thank you, Leslyn, for shooting out the questions to everybody.
Thank you. It certainly was my pleasure. We all are watching the national news, and we're all hoping and praying for some kind of cure, something that would help to keep this disease under control, aside from all the things that we can be doing. Not everybody believes in vaccination, so it might be a vaccine. It might be, some other oral medication that people can take, any number of things, but we all have to do all of the things, including continuing our distancing and wearing our mask and practicing, good hygiene and minimizing gatherings, all the things you've talked about here. As schools reopen, particularly public schools, Jason, I thank you for just acknowledging the human aspect of all of us being nervous as parents with our children returning, and teachers.
Yes.
And paraprofessionals, staff, all being concerned because there's still, as Frank would say, so much that's unknown about this virus. And it seems like day in and day out, things are changing. I was just watching the news with someone talking about a loss of hair that's now associated with this, virus. So all we can do is continue to encourage everyone and urge everyone in our community to do everything we can do, working together, following the guidelines. It hasn't been easy. I will not say it has been easy. The executive orders coming out from the state, every other day we all were in a tizzy about what next and what do we do. Things are shutting down, or things are reopening or not reopening, and so many things that you have to do, the plans you have to put in place. If a college just put out their reopening plan, and I hope that everyone had a chance to take a look at it. It's relatively lengthy. Cornell has done theirs, and we call upon our higher education institutions, the leadership of those institutions, to please continue to work with us and emphasize to your students, as community members, how important it is to be responsible in the face of this disease. So I want to thank you all. From one community member, I think, who put out here in the chat, just wanted to say thank you for, I know it's been hard, exhausting, yes, and there are no perfect answers with many different opinions. As a Tompkins County resident, I'm grateful to be in this county, and I want to echo those sentiments. I know a lot of people feel the same. I know there are conflicting decisions and conversations that are going on, but we are doing the best we can with the information that we have and with the guidance that we have. So thank you for continuing to cooperate with all of us, with the health department, and now with our sheriff's deputies as they come out, and just in your own, with your neighbors, continue to check on them and continue to say to them, if it's not necessary, we really don't need to gather. Let's try our best to stop the spread. So appreciate your time, appreciate all of you joining us. If there's nothing else, Frank or Jason, we'll conclude this and look for us in what, Jason?
2 weeks, I think. We'll do another one in 2 weeks.
In 2 weeks.
Yep, unless something special comes up.
Okay. All right. Thank you all very much. Take care, everyone, and be safe. And please, please wear your mask.